I'll try to give some insights on the kind of things that are on my mind that I'm seeing in terms of the future of prevention. I'll try to break it down into three components. The first part is looking at some of the disruptors in healthcare on the individual and systemic level in terms of what's happening out there. Second thing is giving you some insights on what we're doing at MedCan, looking at value-based care as it relates to prevention. And the third thing is looking at some of the obstacles ahead of us in terms of delivering on the promise of precision prevention. For the babies that are born in 2018, it is an incredibly exciting time in medicine right now. You can sequence the whole genome for genetics. You can do advanced diagnostics through cell-based molecular testing. There are targeted therapies using your immune system. There's targeted soldiers against different kinds of infection. There's the promise of big data. And so I can only imagine what healthcare will be like in the next 5-10 years for our children, our grandchildren. And of course, the influence of technology. Patients want access to their healthcare data. It is easier than ever to get all kinds of data about your wellness, how you sleep, how you think, what you're eating, what you're doing. It's also very easy to get access to genetic information. So there's a lot of direct-to-consumer companies like 23andMe where you can order in and get all kinds of information. So over a decade ago, getting your genome sequenced was like in the millions of dollars, where now it's in the hundreds of dollars. Also, patients are also going to become new sources of providers of data. So the next thing is not going to be the Fitbit, it's going to be the temporary tattoo. As of this month, there's a company called LogicLink, which has this little temporary tattoo which tells you how much UV radiation you're getting based on World Health Organization guidelines. So this will be the next future where patients will start to provide data. About a decade ago, Clayton Christensen from Harvard wrote a book called The Innovator's Prescription, where he predicted that companies would start taking over the health of their employees. There would be less reliance on the state and more reliance on companies to try to wrap their arms around their employees. So as you all know, Amazon, Berkshire Hathaway, and JP Morgan Chase are forming this mega company in healthcare and trying to change the game. We're trying to find different ways to engage with our patients and to try to get them to change their behaviors. Instead of sticking a needle into a tumor to diagnose what you have, you're able to do a blood test to find out what they call circulating tumor DNA. So if you have this cancer that's living in your system, some of its garbage that it spits out floats into your bloodstream, and these really smart academics were able to find a way to mark these and identify the aggressive potential of these tumors. So right now, liquid biopsy is used for people who've been diagnosed with cancer to identify what's the risk of it spreading. But what we're trying to keep our eyes on is when we'll be ready for showtime in terms of early diagnostics for screening. But it's not quite there yet. As we mentioned, companies are getting more and more interested in getting dashboards about the health of their employees. So we've created different ways of looking at analytics to tell different kind of narratives that'd be helpful for folks like you in the room. Measurable health outcomes that make a difference, that are affordable at low price. Health outcomes, low cost. Is data good for patients? So these clever folks out of the University of Chicago looked at this and they coined this term called orthosomnia. And what that is the pursuit of the perfect night's sleep using a smartphone app. What they found actually was too much data created more anxiety. What in precision prevention is ready for us to act upon? Sloan Kettering, which is a huge cancer hospital down in New York, they did a study for about 700-800 patients with cancer, followed them over 7 to 8 years and gave them an app that tracked 12 symptoms. And in live time, they would report back when they were taking their chemotherapy to their healthcare team. And to their amazement, what they found was that it increased the lifespan of the patient by about 5 to 6 months. A couple years before that, a smaller study in France found the same thing. In sort of medical vernacular, it's called patient-reported outcome measures or patient-reported experience measures. Finding a way in live time for patients to communicate back to their healthcare team about what's happening can change the game. So for those of you who've been around people with cancer, millions of dollars are spent on R&D to develop these oncology products to add a few months of life, whereas this is a technology tool where you empower the patient, which actually led to 5 to 6 months of extra life. So it's the beginning, I think, of more studies that you'll see, and this is published in the JAMA, one of the more high-impact journals. So this got a lot of attention from the oncology community.